and welcome to another edition of Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I'm your host, Shawn Needham, along with my wonderful wife, Janet, and we are streaming live from the Team Needham Abode podcast studio, and we are super excited to have Craig Culbertson on our podcast today, our midweek podcast. We met him in Oklahoma City at the FMMA, Free Market Medical Association conference back in April. And he is actually local to our state in Spokane and co-founded a DPC clinic, Choice Family Primary and Urgent Care in Spokane. And we're super excited to hear about that clinic and talk about DPC in general. We've talked about DPC, which is direct primary care, on our podcast before. And it basically gets around traditional insurance. So you have very affordable healthcare, and he'll talk about that. It's less expensive, it's better service, and it's better quality. How can you get that? You pay cash, you don't go through insurance. So without further ado, Craig, welcome to our show.
Thanks for having me. I appreciate the time this morning. So
tell us a little bit about your history and the history of the clinic.
Yeah, the history of the clinic started about 2 years ago. We, my partner John and I, who's a practitioner, he's a PA. We started just having a conversation about kind of the state of healthcare in the greater Spokane area, and he came from a provider background. He used to manage most of the major urgent care clinics for Providence in this area, and I've been managing self-funded health plans for employers for the last 25 years, and we just started talking and said, there's got to be a better way to bring healthcare, especially to small businesses who struggle so much with the insurance side of the equation when it comes to healthcare access. So I started looking at some numbers, and the number that literally shocked my world is when I started looking at some of the our National Department of Health numbers that indicated just in Spokane County, and these are 2009 numbers, but it said that at the time that only about 72%, under 70%, so about 69% of Spokane area permanent residents had no access or limited access to primary care, and I was absolutely shocked. I was blown away. And I said, that can't be right. And lo and behold, we started digging, and the numbers aren't quite right. They were making some assumptions in there about the access to healthcare. But even if you cut that number in half, it's still abysmal. Right. So we said, what can we do to make it better? And we started. I knew about DPC. I've been knowing about it for years. And I said, we can create our own DPC, and we can one up it and make it even better. And I believe, and I could be wrong, but we are the first DPC in the Pacific Northwest that has an urgent care as part of the DPC structure. Because we get to thinking about primary care, it's like, well, what is primary care? Urgent care is nothing more than advanced primary care. So let's do that too. So we did. Yeah. So
I love it. And, just on that topic of access, just so, listeners and viewers understand this, and you can comment on this, is just because you have insurance and you have coverage doesn't mean you can access care, right?
That's exactly right. That's probably the biggest misnomer. Probably that most people, the most consumers of healthcare don't connect the dots there, and it's changing. The consumers are starting to get it, but it's slow. And you're absolutely correct. I mean, we've all run into it every single day. We'll say, well, I've got Premera Blue Cross, or I've got United Healthcare, or I've got whoever I've got. And I said, well, that's great. How long did it take you to get to see your primary care? Or how long do you even have primary care? I just go to urgent care. Well,
yeah.
I've had that conversation at least 100 times just in the last couple of years.
Or do you even get a choice as to who you would like to see?
Right. Yeah. And and let's forget the quality issue for a minute. So the average, we've surveyed probably about 400 or 500 people over the last couple of years in the area. And they said the average time it's taking them to get an appointment to see their primary care doctor is 3 months. Those are established patients.
I will say this though, Craig, okay, for established patients, maybe I've heard 6 months in
I've heard
certain
that too.
states.
Yeah.
And new patient, it's either non-existent or it's
Oh, yeah.
like 12.
Oh yeah, they're not taking. Yeah, a lot of primary care is not taking two patients, and just in the last year, we've had one urgent care and 3 longstanding primary care with large patient panels all retired in the last year. So we not only do we already have an undiminished capacity or an unrealized capacity of our system, it's getting worse. Because we have a huge amount of demand and very little supply. So that's the issue. And as you know, the reason for DPC is because we've all been meddled in the fee for service system forever. And the problem with fee for service is doctors have to cram as many patients into their clinic every single day just to be able to make a living. And DPC doesn't have that problem. You can up quality by seeing patients longer because you don't have to worry about getting to that next patient right now, and to get as many people through your clinic as possible. And that is the miracle and a much more sustainable solution.
So, I mean, considering the service is so much better and the quality is better, like you're talking about, the price must be really expensive. Can you tell us about that?
No, it's not. We did some research, like a lot of the DPCs around the country. We came to a median rate for anyone under the age of 56 years old. The monthly retail rate is $89 a month, and that includes everything we do under our roof. That includes urgent care. That includes your primary care. Anything we do. That we have a lot of point of care testing. We have a full service X-ray. In-house, includes all your x-rays, anything under the roof that it's covered under that. So, and when you consider the fact that the average annual deductible in the United States is over $2,000, that's according to the Kaiser Family Foundation, and going up. I
was going to say that number sounds low, Craig. Honestly,
it does. That's national average. That takes into care all health plans. If you go back east, the numbers get skewed a little bit, but that's the national average based on the last report. It's about, I think it's like $2,100 or $2,200. And but what's most significant about those numbers, if you look at the latest report from Kaiser from last year, is that the amount of healthcare plans that are high deductible health plans in which the deductible must be met before benefits begin for the individual, the number of people switching over from traditional PPO to a high deductible plan PPO are skyrocketing, which means if they go to that urgent care, they go to that primary care, they're paying out of pocket and no insurance is reimbursing them for that deductible limit. We don't have that problem with DPC. You can have the high deductible plan and get great care and not increase your expense limit by doing it that way.
Yeah, and the other caveat is you're transparent about what your prices are, where when these people are going into these other entities, you have no idea what you're going to be charged.
That's correct. Yeah. And we disclose our prices. Have organizations here in Eastern Washington where we actually get their discounted cash prices. We're actually less than their cash price. So if you walk in and ask for their cash price, you come to us, you're going to get a better deal. And we actually pass that discounted cash price directly onto our DPC people. So you can come in for a basic CBC. It's like, it's nothing. Yeah, and we give it to them at cost. So not only are they getting great care, but when instead of paying kind of $152 for that lab, now they're only paying $10 for that lab, and that's what it's all about. We're not in this to make a bunch of money. We're in this to change people's minds about what healthcare can be, and make it more accessible.
So your internet went out a little bit, but can you tell us just quickly about how that lab discount works?
Yeah, so we partnered with a local large lab organization here in Eastern Washington, and they agreed to give us about 150 of their labs below their cash price, and then we pass that cost basically directly onto our members. So if you're a DPC member, we don't upcharge you for those labs. You get it at our cost. So an average lab that is significantly less that you pay it on the insurance level. Matter of fact, it's about 4 times less than you pay it on the insurance side. So it's a great deal.
The numbers are really astonishing. How much labs are marked up, and how cheap they really can be. I mean, when I first heard that, you can get a CBC for $10, it was almost unbelievable to me. And I understand free market in medicine, but it also just realizes how much there's a scam in the system, and there's collusion going on between healthcare providers and insurance companies to overcharge a consumer.
Well, and it's not always, what's funny. I mean, I've been on the payer side for 25 years, and it's yes, there's collusion, but it's in some cases it's almost a one-sided. When you get down to the primary care level, many providers have no clue what they charge, what they bill to insurance. They have no idea. And if you ask them, well, what's the rate you're charging to insurance for that 30-minute office? I don't know. And the reason they don't know is because it's a little bit different for every insurance company. And oh, by the way, the insurance company's already padded their PPO rate in there. Most people don't realize that PPO networks are the biggest financial boon of insurance companies that ever were developed. They get a percentage of every dollar that goes through their PPO plan that gets paid back to the insurance company. It's legalized skimming, is what it is.
Yeah. I mean, it would be illegal in any other industry. It would be illegal.
Any industry, sure. It's illegal.
Right.
Oh yeah.
It's like mob
it's illegal in the insurance industry. Right. Exactly. And it just cracks me up. Yeah. So
I want to give an example talking about, because you guys have urgent care, $89 a month. Yep. Does that include family members, like if you had young kids?
Yeah, so that's a single membership for anyone under the age of 56. Okay, so if you're over age 56, all the way to 100, we up at $10. So now it's 98. Okay, just because you get more chronic and longer issues, you've got longer office visits, so we do up it a little bit for that. If you're under the age of 18, it's $29. For the kids. So for an average family that is in their 40s, they're looking at under $300 a month, well under 300, like $265 to cover a family of 3 or 4 to get all of their urgent care and all of their primary care. I'm a father of 3, and most of my kids are mostly grown right now. But I remember when they were younger and they were in sports and they were in school all day, and they come home with this illness or that illness, or they scraped their knee, or they got to have stitches. We were in urgent care 3 or 4 times a year.
Inevitably. Well, we have two boys who are grown now. But same thing. Snowboarding, break their wrist. So let me, hypothetical example. We're members of your DPC clinic. My son breaks his wrist on a Sunday, and it just needs it needs a common splint, just splinting. Tell us how that works and how much extra I would get charged.
You wouldn't get charged anything extra. They would you'd come into the clinic, they'd x-ray it, make sure it's not more messed up than it is. They'd probably give you something for the pain, make sure it's set properly, put it in the splint, schedule the follow-up appointment, and you're on your way.
I'm going to put you on the spot. What would that cost at an urgent care, at a regular traditional urgent care system?
Well, the X-ray, you're looking at a 3-side X-ray on the wrist, because you'd have to turn it on the radial. The largest imaging organization in Eastern Washington, I know for a fact, charges a cash rate for $150 a side. Okay, so that's 3 sides you're taking on that X-ray. Okay, on that deal, so that's $450 just for the X-ray. Okay. The urgent care visit would be a 30-minute urgent care visit, most likely. Okay, that's going to be $325 billed the insurance rate, probably knocked down to about $200 or something like that. And then you're going to have the splint, which is literally a $10 item. It's not expensive. it might be 25 tops. They're going to charge you $300. They're going to bill $300 for that too. So you're looking at almost $1,000 walking into an urgent care that's going to get billed to an insurance company versus walking to a DPC. You're going to be in and out for maybe the cost of the splints.
And when you say in and out, how long is that going to take routinely?
It's going to be very quick. Yeah, I would say, it doesn't need to be quick, but they're going to check for other things, but they're going to be a lot more thorough. So the 30-minute visit will be 30-minute or slightly longer if there's anything else going on. But they're going to do a full examination to make sure there's any other issues or other things, other injuries. And you're going to have very little wait. I think our average wait time is under 3 minutes.
3 minutes, right?
3 minutes.
And the wait time at the urgent care on a Sunday is probably going to be 12 hours. Seriously, right?
Oh yeah. Here it may not be 12 hours, but I think our closest urgent care competitor, they're seeing waits for minor injuries at least 1 to 2 hours, depending on how many people they got in the lobby. And it's so unfriendly. You walk into a lot of urgent cares, the first thing you encounter is this large plastic screen. I feel like I'm in a bank in the 1930s where you got to slip your things through. Yeah, ours is we work with people. Yeah.
And what's the first question they ask you when you walk in? The very first question.
Oh, do you have your current insurance on file?
What's your insurance?
Every time.
They don't care about what's wrong.
No.
Did you break your wrist? What? No, that doesn't matter. What insurance do you have?
That's right. Every single time. Yeah. No, it's crazy. Yeah. Even the people that come to us on a cash basis, they're thrilled because they get great service. And it's because of the DPC side, it relieves the amount of patients we've got to see every day, and be ready to see every single day. And the providers win too, because they're not totally stressed out trying to. You already know this. The average primary care visit in the United States lasts under 15 minutes. Okay. That doesn't, and then the provider spends another 15 to 20 minutes coding that into the insurance information to submit the insurance. Okay, so half of the provider's time is wasted entering data. That's not what they went to medical school for. So yeah, so it makes no sense.
It's not very rewarding sitting in a room, which I've experienced that, where all they're doing is checking the box. They don't even really see you. Who are you? What's more important is their computer and what they're checking. And it's like, this was supposed to be between us, not that. And really what's happening is they will not get paid unless they check that box. That's what's driving them. It's not who's in front of them.
Exactly right. Yeah, that's totally true. Yeah. And it's funny because in probably every urgent care, every primary care, well, most primary cares anyway, but certainly every urgent care, what's the one piece of equipment that's in every urgent care room?
A computer.
It's a computer. It's not. There's no diagnostic. There's a computer because they have built access to code. We don't have computers. We don't have any computers in our treatment rooms. There's no need to. Because we still have to keep medical records, and they still do some of that, but the amount is way reduced.
Yeah, I don't think people realize that all that documentation, the only reason that documentation is necessary and is done is for billing insurance purposes. That's it.
That's right.
It has nothing to do with their quality of care.
No, it doesn't. The AMA doesn't require half the requirements that the insurance industry requires when you go to bill to an insurance policy of almost any kind. But it's wild. But DPC is going to grow. It's taking a while to get the market educated, and it's going to be. I'm absolutely convinced it's going to be more the norm, especially at the primary care level. In the coming decade. And I think people are just going to be able to accept that to be no different than their gym membership or their country club or their Netflix membership. I'm a member of this clinic. I'm a member of this clinic. Yeah, that's the way it will be, and I think that's a good thing because I think they're going to get better care, and the doctors are going to have a better experience, And you're going to get more providers wanting to go into primary care and family care, which right now is a challenge.
Yeah. And I think it, like you say, it's twofold. It's consumers driving it, but it's also healthcare providers driving it, because they are just, you talk to your average primary care doctor that works in a traditional setting where they're billing insurance, and they just don't like what they're doing at all.
No, they don't. Yeah.
They're seeing 30 or 40 patients a day?
On average, yeah. Each doc. So if you got 3 or 4.
Do the math. Yeah.
All right. Do the math. Yeah. And it's crazy. Yeah. So, and we don't need to see near that many. I mean, we need less than half those patients per doctor in the clinic per day to make it all work, which gives the doctors way more time to do quality work, get to know our patients, really find out what's going on, and make sure that they have covered all of the issues.
Well, and not always do they have to be seen, correct?
Not always. No. Yeah.
Tell us about that.
Well, a lot of times, our doctors prefer to see people directly, but telemedicine has really taken this idea that you can diagnose all of this stuff in a telemedicine appointment, and certainly that some of that is true. You can get care and assistance over a telemedicine structure, but the problem is that for a lot of providers, it takes away the human element of healthcare in many ways, and providers, they will do it, but they don't like it, and I think they're all secretly, and certainly our providers have made this comment, say, well, I don't really know everything I need to know to diagnose what I'm getting here. And so there's a quality element that is missed there. So we don't always need to see people right away, and they can certainly call in and talk to our doctors and find out what's going on with themselves, but and get that assistance. But it's amazing how many providers do solely telemedicine, especially on the internet channels. And they've gotten away from physical touch medicine, where you got to feel your throat, you got to find out what's going on.
Right.
And you can't do that. So
Well, I can see when it might be appropriate to review some things and check in, but I think you're right that getting back to where we actually touch a patient and look at the patient is super important. And I think the shift from what you're doing is to get back into that role of where you have a relationship. I think that's huge, because that's what's been missing. Like, we for some reason shifted to my relationships with the insurance company, not the client or the patient. And so prevention was totally lost in that whole picture, because you have well, not always, but a lot of times you lose that connection of, what's going on in that person's life if you're not communicating with each other.
Absolutely. No, it's totally true. I mean, and the financial burden that people have on the insurance side for healthcare, it is a health problem itself, because the amount of stress it causes in people's lives is ongoing. And I mean, the vast majority of Americans, they live, with relatively low levels of emergency savings. I think the average savings rate in the United States is under 2%. That's not good. And to illustrate that, we had a young mom come in about 2 months after we opened, and she had a very high deductible. She had like a $5,000 deductible healthcare plan. She asked if we would take the insurance. I said, well, not really. But she was down at the urgent care down the road from us, and they had a 2.5-hour wait. She had a 7-year-old kid who was having severe headaches, and they were sitting in the lobby, and the kid was miserable. We got him right in, and she would have to pay the entire visit, towards her deductible. And we say, hey, this is what they probably would have charged you. Turn this into a membership, and you're covered for all. She had 3 of the kids. All your kids are covered for all this time period. She signed up like that. She's one of our literally happiest customers. She cried at the end of the deal because she was so happy that she got in, and she now has care and she doesn't have to worry about it. She was so exhilarated.
Well, and it's something you can budget for. You can budget for that monthly $89.
Yeah.
And that's why you mentioned gyms, you mentioned Netflix. That's why they have monthly subscriptions, because you can budget for it. And then there's not these surprises. That surprise urgent care visit that was going to cost her $1,000 that she didn't have. That's something to make you cry.
Yeah, no, exactly right. There was a Milliman study that came out a couple of years ago, and it was talking about the barrier to care, is the way Milliman puts it. And the barrier to care exists in healthcare today because people are aware of that large deductible, and they're becoming more aware every day. And there's a threshold of seriousness to an injury, illness, in which they will not go to ER urgent care if they believe there's an affordability issue or it's not urgent in their sense. Well, now you're asking individuals who have no medical training to determine whether or not their particular issue is serious or not. That's a problem.
Yeah.
And when you go to a DPC model, that problem goes completely away, because they can come whether it's a minor thing or whether it's a serious thing. It doesn't matter. They can just come and know it's going to get taken care of. And one of our slogans, back to your point, is we say, hey, real healthcare for cheaper than your cable bill. You know what the average cable bill in the United States is?
Probably over $100.
It's almost over $200. It's $196 a month for average. That's your average cable bill. That's across all providers, U.S. You can get healthcare for cheaper than your cable bill.
Well, one of the things that I usually say, Craig, is that you can get healthcare for about the same price you pay monthly for your cell phone.
Seriously, and that's totally realistic.
And people who doesn't have a cell phone.
Yeah, so and everyone's got one of these. Yeah,
right.
And they all pay through the nose for it. Well, at least I know I do.
Yes, and they say healthcare is not affordable yet. Everybody has a cell phone, so healthcare is affordable.
It is affordable. If
you got to know where to find it. Another thing is too that I want to mention is that it's not just about deductibles, but also co-pays.
Sure.
So we see it all the time in our industry when somebody goes into a direct care clinic like yourselves,
and
they say, well, I met my deductible this year. I know you want to order all these labs. I want you to bill my insurance for these labs. You probably heard this story before.
Yep.
And the provider warns them, okay, I can do this. You can either pay $100 now, cash, or I can bill your insurance, and I have no idea what the cost is going to be.
Yeah.
Well, next thing you know, the labs are over $1,000 at the local hospital.
Yep.
And their copay is 20%. So they paid $200 for these labs when if they would have paid out of pocket, it would have cost $100.
Happens all the time. Yep.
All the time.
All the time. Happens all the time. Yeah, we've had that happen. Yeah, I know. It's ridiculous. So it's like, well, we can get you the same lab for half the price. No. I want them to go to my insurance. Like, okay.
Imaging falls into that.
Imaging's another one where they get ripped off commonly.
They get totally ripped off. Yeah. We're charging. Our imaging rates. We will do cash imaging rates for people who aren't even our patients. If we get referred by chiropractors and other people all the time, we'll walk in and it's $75 for an X-ray. They're like, wow.
I know, right?
Yeah. And they're like, oh wow, because it would have been $300 or $400 if they'd gone to the other one. Yeah. So yeah.
So Craig, as we wind this podcast up, tell us what you have a passion for.
I have a passion primarily to make healthcare easier to access for everybody. I've been on the insurance payer side for 25 years. I design and manage self-funded health plans as a profession, and now I help run a DPC clinic too. And the whole goal between those two connections are to make healthcare less expensive, expose the margins, make it more transparent, and get people to understand that it doesn't need to be this big government system. It can be a local experience with a local provider, with a local price who tells you what it is, so you can actually get the care you need and afford it. That's the whole ballgame. And I sleep very good at night knowing that we're making at least a small impact in our community. So
I love it. So tell us how somebody, if they want more questions about have more questions about your clinic, tell us how they get a hold of you or can sign up.
They can sign up right up on our website, choicefamilies.com. They can call our clinic directly and get more information. We have a wonderful front office manager who loves people and loves to hear their story. They can. We have 3 different types of memberships. We have a 12-month, a 6-month, and a 9-month membership, depending on what fits their needs. And we would love to show them that healthcare can be something that is easy to access and does not have to be a headache. So.
I love it. I love it. Well, Craig, thank you so much for being on our podcast today. You've helped us realize our goal, which is to educate and empower consumers to take charge of their own health. So thank you so much.
Absolutely. No, thank you. I appreciate you both. So,
yeah, thank you. And listeners and viewers, thank you for tuning in to Health Solutions with Shawn and Janet Needham. Tune in to our regularly scheduled podcast Monday, 12:30 to 1:30 Pacific Standard Time. Thank you for tuning in.